We'll discuss now one by physical assist anterior pelvic grasp transfer from the bed to the chair. Before we go too much into it, it's important to say that this is not your first point of call or the highly recommended transfer. It's really prescribed, assessed and prescribed conservatively, looking at residents' compliance, cognition, and physical ability to assist with the transfer. It can be an at-risk transfer for the therapist or care staff, so make sure it's very carefully prescribed and directed by the assessing therapist. We'll always position our client or consumer to the front edge of the bed or the chair, and we'll adjust the height of the bed or the chair to make sure we can maximise the physical abilities of the client. As always, we'll make sure that the brakes of the bed are applied. Encouraging the consumer to wiggle forward a little bit more to the edge of the bed, making sure their feet are apart for a big base of support, which will increase their stability upon standing, and their feet are backwards as much as their knee flexion or knees will allow. We will stand on the affected side of the client or consumer if there is an affected side. Our hand will cross over to the contralateral hip of the client or consumer with our shoulder into the anterior shoulder of the client on the ipsilateral side, with our hand supporting the trunk at the back. This will give us full control over trunk lean to facilitate a safe standing technique. We'll always instruct the client or consumer to use their upper limbs to assist the standing position, in this case pushing off the bed. Clear simple cues are indicated, being forwards, backwards and stand. We'll change our hand positions to support a transfer, which is hands across the lower back to the contralateral hip, and we may guide the resident just for directional guidance, not physical support, using the upper limb. We'll assist the client to transfer to the destination, in this case being a wheelchair, making sure that the brakes of the destination are applied. We'll make sure we guide the upper limbs back to the armrest, and we may assist with some gentle pressure in the front of the hip to facilitate a sitting position.